Hi everyone, I'm Roland. I'm here with Lucy Filce today, Pilates instructor. I'm Roland Baskerville and I practice Bowen technique. And we thought we'd put together just a little talk between the two of us today to explain a little bit more about how Bowen technique and Pilates complement each other really well. Thought people would probably find it quite useful as we've often referred to each other over the many years that we've known each other. I've been practicing Bowen for since about 2008 now. Um, Bowen is a technique that helps the body to rebalance and correct itself, a very gentle form of body work. And I'll introduce Lucy now if you want to introduce yourself a bit and just a little bit of background about yourself and what you do.
Hiya, Roland. Nice to see you.
Oh, Lucy.
So I've been teaching Pilates for about 18 years, a long time. And I started off just doing classical mat-based Pilates. And now I do a lot of rehab type work. I started to do my CPD training in rehabilitation exercises. And I also do attend a lot of lectures with the orthopedic and Birmingham knee and shoulder clinic. So I keep up with the surgical best practices. And I did my GP referral qualification in 2022. So yeah, I teach three public classes a week. One of those is a specific back care and injury rehab class. And the rest of my time I spend doing one-to-ones, which is mainly for specific injuries. My age range is huge, and a lot of what I do is preparing people pre-operative and post-operative for things like knee replacements, shoulder replacements, hip replacements, and general bad backs. That's mostly what I do.
Fantastic. That's a great set of skills there, especially specializing in helping people with surgery and that kind of thing. And that's a similar path that I've gone down. I started off in personal training originally, but then became more interested, like yourself, in rehabilitation, helping people with injuries or people with special conditions. So maybe we can start just by um, why body balance is so important, because that's both something that we work on, that we focus on in our work. So maybe if I just talk a little bit about how we do that with the Bowen therapy. So the body has its own way of balancing itself in gravity and in space. And there's certain sort of special nodes or sites on the body like receptors. And with bone, we make a soft rolling type motion or a popping type motion over these key junctions of the body that then seems to trip the body into a state of self-regulation. So, for example, like if someone's got one shoulder higher than the other or their pelvis is twisted, quite often when we hit these sites, then the body automatically gets the message that it's in the wrong place and then self-corrects. So it's not forced into a better position, but it's touched in a way that helps to allow its own automatic systems to recognize that it's out of position and move itself into place. And this helps to prolong the life of the joints, make the body run efficiently. Because if the spine's out of position, then muscles have to work a lot harder than they should be doing. And then that can cause injuries and wear and tear over time. Um, so that's just a little bit about how I use Bowen to balance the body. And Lucy, do you want to talk a little bit about that same body balance and what that means in Pilates and how you work with that?
In a strange way, it's incredibly similar. We're doing the same thing, but our method of doing it is different. So when I'm looking at somebody who's got injuries or pain, or they've had a specific procedure that they need to be recovered from, I am looking at where the body is out of balance. So I'm doing like a postural assessment of them. I'll walk around them, I'll get them to do certain movements so I can assess where posturally the body is not quite in balance, not quite in the right place. And then I'm doing a similar thing where I'm tweaking muscles and using this whole kind of like opposing forces, kind of where one muscle will be overstretched and another muscle will become tight. Um, I'm then exercising the muscles. I'm strengthening in one place and lengthening in another place using exercise to bring the body back into balance. So it's a similar kind of thing, but we're activating the muscles to move the body back into a state of balance. Um, and it's a lot about assessing which muscles might be weak, so which muscles aren't doing their job, where other muscles then start to compensate. So finding the overcompensating muscles and trying to relax them and quieten them down, and finding the muscles that should be activating and they're not, and then getting them to activate and strengthen. So it's a similar thing that we're doing, but mine is a much more maybe active way of doing it where I'm sort of making the muscles move into places and activate.
That's great. Thanks, Lucy. That's really interesting. Um, and also, like as we've referred to each other over the years, it's good to explain to people why we do that. So, with Bowen, the body can restore its balance and reintegrate itself. But one thing Bowen won't do is it won't strengthen weak muscles. It'll help the body to rebalance itself into a better position. But then it does need strengthening and a regular exercise to help maintain that integrity. Because even when the body's reorganize itself into a better position, if it's still got lots of weak muscles, it's more vulnerable that it can slip out of place or a person can't maintain their integrity. So from my part, um, I know that Pilates is one of just an amazing exercise for supporting the spine and building strength around the spine. And it's our core energy center is the spine, the jaw, the coccyx, and that central part that we work on a lot with Bowen. And if you have that central part strong and balanced, well, you just live a much you live with ease, and everything is just so much better. So to me, it's like I kind of rebalance the body, but in order to maintain that regular integrity is by referring to someone like Lucy and Pilates to help to keep that all keep that all together basically, so it doesn't slip out again in the future. Do you want to share a little something about that as well, Lucy? Like why you've referred to bone in the past or how you see that from your end?
Yeah, so I don't do any hands-on work with people. I don't physically touch people. I do visual observations, and then we work with exercises. And sometimes, so we can do a lot of balance there. We can do a lot of changing posture. But sometimes the body just needs that extra little bit of help. So it needs like a hands-on physical adjustment, or what you're doing with these gentle movements, which allow the body to come back into a level of balance. So it's like this sort of missing little bit in my practice, which is why the two practices complement each other so well. Um, yeah, you just touched on core strength and core stability. That is the main focus of Pilates. Um, and we use the arms and legs essentially to add resistance to working that central core stability. Um, and what Pilates also is very good at doing is teaching people how to reconnect with their body, how to find muscle groups, how to actually think, oh, right, okay, I need to use that muscle to do that action, where they've never really been able to think about how to use their body before. And it allows people to learn how to isolate muscle groups as well. So a lot of the exercises are based around holding one part of the body completely still whilst just using another part of the body. Um, so it's this isolation, this ability to hold steady and activate, um, which builds just really, really good stability, not just around the spine. It will build stability around every single one of the joints and just more body awareness.
Yeah, I know a big thing with what happens with Bowen is that because it's a very specific and technical way of touching the body on very specific sites, it quite often helps to build a connection in the person's own body awareness to their body in areas that maybe they're not so aware of. So the touch is one way of like connecting the dots, if you like. And this specific type of movement that you do in Pilates again is sounds to me it's another way of people becoming much more aware of structures in their body that they might not be thinking about. And then when they are thinking about them and connecting with them more, there's a lot more integrity in the body. So I think the combination of the touch, the hands-on awareness, the mindfulness of the person doing Pilates, really complements them very well. And I just wanted to mention that I had a lady that I work with who's a trauma therapist, and it's not just core strength. I mean, she said that one of her clients started Pilates and it absolutely changed her life, psychologically. So we tend to store, people are talking more about how we store trauma in the viscera and around the belly and these sorts of areas. And actually, when you open that up and you start working with it and breathing through it mindfully, it's like in some ways you're having a counseling session without speaking, right? Um, is that something you come across sometimes when people are really working through some stuff, when they work deep into that sacral area, into their belly, into their breath, into their lungs, because it's the whole thing is together, right?
Yeah,
Integrated system.
yeah, definitely. Won't I won't claim to know a great deal about trauma. It's not my area of expertise. However, the small amount I do know about it is we store our main memories in the hippocampus. We store our traumatic memories in the amygdala, which is why we have a different response when we're remembering things. It's more in the mind. When we remember traumatic experiences, it's very much a body experience. We'll have the same body reaction that we had when we were in the traumatic um, instance. So the cortisol will be going, the adrenaline will be going, the body will be tense in certain places as that memory is recollected. Um, so yeah, I've witnessed that a great deal, where people have accessed parts of their body that they've literally completely shut down. Um, and then they start to re-access those parts of the body, and that comes with emotions and all kinds of things. But you touched on the breathing there as well, and I think that is a massively powerful part of Pilates. It is done in coordination with the breath. It's done in coordination with the breath, mainly because it helps the body to engage the core muscles. So when you exhale, you're able to pull in the core muscles and engage. Um, but when people really connect to moving and breathing in unison in this pattern, um, it changes people's world. It makes them calmer. They
Mm.
sleep better. People always say to me, "Oh, I always sleep so well after I've done one of your classes." Um, there is an element of, yeah, peace of mind, restfulness that comes with spending an hour being mindful with your breathing and with your body. It's
I
very
think
powerful.
I think so, very much so. I think that's sort of like solar plexus and that like, deep lower dantian, it's sometimes called in Qigong, or that body power area just under the belly button and that central base. I mean, a lot of us in modern lives could be sat in a car all day, sat at a desk all day, There's not really that much happening in the hips, is there? And it's all the body thrives on circulation and openness. And I think things can almost stagnate in terms of even if you just look at it on a circulatory level. So when people lie down, they breathe deep, they move, they open their hips, they stretch, they twist, they bend, and all of this is being massaged with that deep breathing as well. It's like it's no wonder that we come out of it feeling like we have had a massage. We've self-manipulated and opened and moved and stretched and breathed through so many things that just sort of sit there. Yeah.
Yeah. I mean, when you're rotating the spine, if you're doing spinal rotations, any of the manipulations that you do, your organs are moving.
Yes.
You get a little squeeze on the kidneys, you get a little squeeze on the liver. Um, this isn't, it's detoxing, it's bringing circulation to areas that maybe don't perhaps get circulation when you sat at your desk, sat in your car. Um, so yeah, these kind of practices are fantastic for the body, for the mind.
Absolutely. It's all together. One thing that's popped into my mind as well is that what I see from these sort of like mindful exercises like yoga, Pilates, you can actually self-manipulate. You could quite often use that to self-manipulate sometimes back into level pelvis and different things through your own mindfulness, holding and awareness. And I just wanted to say that there's certain sites that are a bit more tricky, and this is where I find Bowen has got a real edge. And there's certain sites that sometimes get a bit stuck are the jaw or temporomandibular joint up here and in the atlas, and sometimes in the coccyx. If people have had a fall on the coccyx and the tailbone slightly off, it can be quite stubborn. And one of the things I've come across sometimes yoga teachers and people I've treated is those they're very well balanced, very strong, and everything's there. But sometimes it tends to be the jaw or coccyx that seems to be those little sites that can get stuck slightly off. And those microsystems, as they're called, like cogs in a machine, it might be a smaller cog, but then when it's wobbling, it sends a wobble into everything else that can cause like hip pain and different things to manifest. So, yeah, I just wanted to share a bit about that, like why someone would come in for Bowen, say if they're like quite fit and they're training well, but they're noticing, oh, I'm getting some
Mm,
migraines or something doesn't feel quite right around my jaw or my tailbone. Those are often good flags to think, give Bowen therapy a try.
yeah. I like the way you sort of briefly kind of touched on referred pain there,
Yes.
because often the dots aren't joined. Um, I mean, recently I was seeing somebody for knee pain, and I'd done 6 sessions with them. We'd done a load of things around knee pain, and then all of a sudden they had the socks off, and I was like, "Oh, you've got a flat foot. That's what's causing your knee pain." So we started to work on the foot, stop the knee pain straight away. So it's like
Amazing.
everything's connected. Sometimes, the thing that we often say is where the pain is, the problem isn't. Often, where the
True.
pain presents, the problem is somewhere else down the chain. It might be the shoulder that's hurting, but the problem is the hip joint, and
Yes,
it's wiggled its way up through that chain of movement.
that's right.
Um,
We often say in Bowen or different therapists that pain often appears at the weakest point. So there could be something else, a root elsewhere, that's leading on to that. That's why it's such a good combination of two together, like working on different areas. And it's always good to for people to try a range of different things as well, isn't it? Like, because there might be that one thing that really makes a big difference from them. Although, I'm a bit biased, I'd say that everyone benefits from Pilates because it's like if you keep that core and that integrated center and balance there, it just helps you with any job that you do. I know when I've done more of it that when I'm working or I'm doing massage therapy or Bowen therapy, I feel my back's different when I'm working. When I'm leaning over people and my balance is better, my awareness of my belly and core is better, and how it gives you so much more strength when you're lifting heavy weights, when you have that ability to squeeze your core muscles and fire it through. I feel like we could probably talk for hours around these subjects, so but I'm just wondering what is a good amount of time. But do you think that's maybe enough for today there, Lucy? What do you reckon?
Yeah, I think so. Yeah, it's been really nice to talk to you and
Yeah,
share
it's
some
been really
stuff. Yeah.
interesting, hasn't it? Just sort of going out. It's been really interesting for myself to talk about these things and the work we do. We've not spoke to each other that much in all the years on the odd occasion, but yeah, it's nice just to have a good chat about what we're doing.
Yeah, it's good.
All right. Well, thanks for listening, everyone. I hope you find our talk interesting.